Hello everyone, I'm Deepthi from Avi Dental College, currently doing third year BDS, and I want to congratulate all expectant mothers. And that moment when all your friends are dieting and exercising, and you're just pregnant, and you'll be like, "Baby wants a cupcake." So now you all will have something to blame your weight gain. So it's very happy thing, right? And I know every day in pregnancy is not an easy thing, but pregnancy is something which changes you as a person, and it's an amazing journey that shifts your focus and pushes you to re-evaluate your life and priorities. So the entire routine will matter. You have to take care of your health and eat nutritious food because it's not just about your health, it's also about the babies. So it's the time for us not to think our mouths are somehow disconnected from the rest of your bodies. The same blood will flow, the same nerves will pass through them. So, to have a healthy body, you need a healthy mouth. So, what is oral hygiene? It's a process for keeping mouth clean and healthy. And pregnant women are susceptible to wide range of oral health condition, and that could be harmful to their own health and future of their babies. So now I'll talk few important set of things one must follow to maintain the oral hygiene during pregnancy. There is lot of changes to oral health of mother takes place during pregnancy. And the first thing is hormonal changes. Because of the hormonal changes, gingivitis can be seen, which is the most common diseases in pregnancy. Many tissues undergo certain changes because the placenta produces higher level of estrogen and progesterone during the pregnancy. In this period of time, gum becomes excessively sensitive to dental plaque and which can cause swelling and bleeding. Gingivitis is commonly known as pregnancy tumors, can be seen very oftenly. Usually starts at the second month of gestation and reaches the highest level at the 8th month and heal spontaneously after the birth. How it happens: when the growth of gingiva is localized to one area, pregnancy tumor can be seen. And these gingival changes can also be called as gingivitis simplex, gingivitis ulcerosa. What are the causes of these changes? Because of the rise in progesterone level in bloodstream, which increases the vascular permeability. And another cause of this phenomenon is lower level of vitamin C. Till now, I told what all problem pregnant women face with respect to gum. Now it's about the teeth, how hormonal changes affect them. Usually, tooth decay increases during pregnancy. Painful teeth, tooth losses can also be seen. Reason being, fetal need for the calcium requirement for intrauterine growth is obtained from the mother's teeth. Vomiting during the pregnancy can increase the acidic environment in the mouth, which can lead to the erosion of tooth, and there is a decreased saliva flow. Because of all this reason, the formation of dental caries increases during the pregnancy. When it comes to dietary changes, all the pregnant women will have this odd cravings which may lead to increased consumption of food with carbohydrates and sugars, adding to the risk of caries. And we'll see reasons why dental carie occurrence is more during the pregnancy. Pregnant women bleed more readily due to the effect of pregnancy hormones, that is estrogen and progesterone. So consequently avoid brushing their teeth. As a result, bacterial plaque increases. However, changes in dietary habits, frequent acid and hormonal changes may add to the risk of dental caries during pregnancy. So to avoid all these problems, expectant mothers should follow the rules. Brush the teeth with fluoridated toothpaste twice a day. If the toothpaste causes nausea, a different flavor or reduced amount of toothpaste can be used. Toothbrush should be replaced every 3 to 4 months or more often if the bristles are frayed, and should not be shared with anyone else. Rinse every night with the alcohol-free mouthwash. After eating, the expectant mom can use a xylitol product to enhance the oral hygiene. Chewing a xylitol containing gums or other products such as mints which can reduce the bacteria that can cause tooth decay. If the expectant mother has morning sickness or vomiting, they can rinse their mouth with a teaspoon of baking soda in a cup of water to stop acid from attacking the teeth. After rinsing, they can brush their teeth because the acid has been neutralized. They should not brush the teeth right after vomiting, again which will cause the erosion of tooth. Now we'll see how nicotine and alcohol consumption during the pregnancy will affect the oral health and the baby. Smoking negatively affects the oral health, mainly the gums, and it will increase the number of filiform and fungiform papillae on the surface of the tongue, which is called a smooth tongue. So oral hygiene becomes difficulty to maintain. Change in oral health of a mother will also affect the baby indirectly. There are around 4,000 different chemicals in cigarette smoke. The acids, aldehydes, ketones, cyanides, carbon monoxide. They have direct toxic effect. Carbon monoxide, which is present in 4% of cigarette smoke, is known to prevent transport of oxygen by binding to hemoglobin in red blood cells. The hemoglobin oxygen transport capacity of smokers is reduced by 2.5% to 15%. As a result, the oxygenation of fetus decreases, so the possibilities of abortions, stillbirth increases among smokers. Also, when the baby is born, the birth weight is less than the normal. Early or late neonatal deaths are seen much more frequently among the babies of mothers who smoke. Overuse of alcohol consumption is teratogenic in babies and can cause fetal alcohol syndrome. Epithelial growth factor receptors are responsible for dental proliferation and differentiation. Changes in these receptors due to alcohol consumption can lead to dental anomalies. And it can also cause hepatic and oral pathologies in mothers and can indirectly affect the baby's condition. Let's see what all things we have to keep in mind while taking the treatment. If there is approval from the doctor of pregnant women, we can perform uncomplicated treatments. In terms of stress to which the mother and the baby will be exposed, effective dental treatment in the first trimester should be avoided. This period is very sensitive period because it's a stage of oogenesis. Unnecessary intervention can lead to abortions. When it comes to taking treatment in the last trimester, sitting for too long in dental chairs can cause vena cava inferior syndrome, that is supine hypotension syndrome. In this situation, turning the patient to the left side in semi-sloping manner will help to relieve the venous circulation. Also, the mercury gases released during the dental treatments are unlikely to produce teratogenic effects. They should be avoided so that the patient do not inhale intensified mercury gas. Let's see what are the pregnancy outcomes. Gum diseases during the pregnancy may influence the pregnancy outcomes via inflammation pathway. That is preterm birth, preeclampsia, low birth weight babies. So to sustain oral and dental health for lifetime, effective and adequate care is essential. Pregnancy is not a disease state, but instead it's a sign of being healthy. A healthy person is not expected to lose their teeth without any reason. So same rule is valid for all the mothers here. If you take simple precautions and guidelines which I told, you will not have any loss of teeth and other dental problems. Thank you so much for listening. Have a nice day. Thank you.